and welcome to my channel. I'm Eloise and I've been a UK pharmacist for over 20 years and I'm passionate about clear, accurate information that everyone can understand. I want this to be aimed for everybody, whether you take medications or whether you work in healthcare, anywhere from being from the receptionist all the way up to the top consultants. I want everyone to understand their medicines and supplements and be able to do self-care within a budget. This is my introduction video where I'm going to explain my background as a pharmacist. There is a lot more to me in life. I am also a mother to a daughter, as well as cats and rabbits. I'm a geek into card games and board games and sci-fi, but this video is about who I am as a pharmacist and where I want my YouTube channel to be going to in the future. So, as this is going to be a YouTube channel, I would be appreciating it if you can subscribe and like if this is the sort of information that you would like to listen to, and feel free to comment with all the subjects and questions that you would like me to cover in future videos. So my background as a pharmacist, I did my actual pharmacy degree at Nottingham University, and following on from there, I became a hospital pharmacist. This is where I worked in the dispensary in the hospital, providing the medicines for people to take home, as well as the medicines on the wards. I would go up onto the wards and check people's medications on there, provide advice to the doctors and nurses on the ward about the medications, interactions, and the best possible medications for an individual. I'd also work in the sterile unit where chemotherapy is made, as well as the bags of intravenous food for adults, as well as for tiny neonatal babies. I really did enjoy my time as a hospital pharmacist, and that came to an end after 4 years. But then I decided I wanted to move into a more challenging role and a different role, and I applied to what was then called a primary care trust, which has then also then changed into a clinical commissioning group and has recently changed yet again into an integrated care board. This is just actually a board of healthcare professionals, as well as some admin, that provides all the support to GP practices in their day-to-day running of a GP practice. And I provide the running and advice around medications. So in my day-to-day job, I have my team looks after a group of 28 GP practices, and I personally support 4 of those more individually. So I provide support for the GPs, the nurses and the pharmacists on anything clinical in regards to having the most up-to-date clinical information on drugs, the new drugs coming out, new information about side effects and cautions with older drugs. I also help the reception staff and the repeat prescription clerks on how to actually do all the repeat prescriptions, when they need to flag things for clinicians, when things are just routine and can be processed. I also do a lot in regards to the computer side of repeat prescriptions and ensuring that they're all logged correctly and accurately, and things that can be passed from the GP computer system through to the community pharmacy computer system, as well as trying to integrate into hospital computer systems. Along with that support, I also provide guidelines and links with hospital consultants. My main areas that I have looked after is gastroenterology and ophthalmology. So in regards to gastroenterology, I am well known for my laxative guidelines that have been used throughout the country, and I'm often the butt of a few jokes about being able to talk about poo. I'll quite happily talk about it, even if everybody else is eating, and I have to remind myself that other people don't have the strong stomach as I do. In regards to gastroenterology, it also moves on to other conditions such as Crohn's and ulcerative colitis that are pretty severe, and these drugs, the drugs that are needed to treat these, are pretty potent. They're also fairly expensive and used by the hospital. So I do a lot of work with the interface with the hospital on how to prioritise using these extremely expensive biologicals and ensuring the patients with the most need are getting these medicines when they require them. This is also rolled into similar drugs are also used in rheumatology and dermatology. So I've been involved in writing the guidelines for them conditions as well, such as psoriasis, eczema, and also rheumatology, rheumatoid arthritis, psoriatic arthritis. Along with this, it seems totally separate, but I also have ophthalmology with the eyes and eye drops. But recently, there has been now these newer expensive agents for treating age-related macular degeneration and squeamish alert here. But these are very expensive injections that go directly into the eye. And these are a big cost to the NHS budget, but keeping people's eyesight into their 70s and 80s can be a massive improvement in keeping people independent. So I am involved with that. So I do a lot of monitoring of all these high cost drugs, the high cost drugs used by the hospital, as well as the thousands and nearly millions of prescriptions that are done by GP practices every day and week. And I do a lot of analysis of this data. I'm also known as a Excel queen and geek because I love looking at all this data and analysing it in a way to ensure the best value of the NHS money in the medicines that we use. We want to make sure that we use this medication for the people that really need it within the limited resources of the NHS. I hope that gives you a bit of an explanation of my background and where my expertise lie. I would love for you to join me on this channel and get involved. So if you could subscribe and like, and I would appreciate any comments on any future subjects you would like me to cover. One of my first thoughts is laxatives, seeing as it's one of my areas of expertise. People think it's a very low priority area of medicines, but actually constipation is one thing that actually affects the majority of people at some point in their life. It's also the side effect to many other medications is constipation, and that needs looking after. And ensuring that you get the right treatment straight away can help prevent severe problems in the future, such as blockages and, in the worst extreme, rupture of your intestines. So that's one of my first ideas. I'd also like to be able to explain the differences between allergies and side effects, explain the different effectiveness of medications. But what I really would like to know is what you would like on this channel, because I am going to be doing this channel for everyone so that everyone can understand their medicines, understand their supplements, and do the best for them. Obviously, I will have to add the disclaimer that this channel will be for just health education, to put you in a better spot for you to be able to talk to your healthcare professional. I cannot provide advice for individuals on this channel, and you should always go to a professional for that advice. Thank you for listening to this introduction, and I look forward to all your comments and your interaction in the future. Thank you.